Well, thanks everybody for coming in what I think is a very, very exciting day for Vermont. And I want to thank Senator Welch, Dr. Mert Aksu, the Dean of the University of Detroit Mercy School of Dentistry, and Patrick Gallivan, who is the Executive Director of the Vermont Dental Society, for being here with us today to celebrate the construction of the first ever clinic specifically designed to train dentists here in our state. Once completed, this will be the largest dental clinic in the state of Vermont, with 49 dental chairs and the capacity to treat thousands of patients every single year. At a time when many Vermonters are unable to afford dental care or find a dentist, this is a major step forward in increasing access to quality, affordable dental care. It will also, importantly, help us to train and recruit the next generation of dentists in our state, something that we desperately need. Thanks to this program, 32 dental students will be coming to Vermont in the first year, and 64 students every year following. This is taking place through a unique partnership between the University of Detroit Mercy School of Dentistry and the Vermont Dental Society. This partnership is especially important because Vermont is one of only 13 states in the country that does not have a dental school of our own. This project took an enormous amount of work, and I want to personally thank Dr. Aksu and Patrick Gallivan and the Vermont Dental Society for getting this project off the ground. When we talk about the healthcare crisis in Vermont, and we have a major healthcare crisis in Vermont and throughout this country, we often ignore a very important aspect of that crisis, and that is that tens of millions of Americans are either unable to afford or unable to access the kind of dental care that they need. And the sad truth is that over 70 million adults, including 187,000 Vermonters, have no dental insurance. Further, as part of our overall healthcare crisis, we have a very serious shortage of dentists, dental hygienists, and dental therapists in Vermont and throughout the country. In fact, some 64 million Americans live in areas where it is difficult, if not impossible, to access dental care. And because traditional Medicare does not offer dental benefits, something that Peter and I are trying to rectify, 26 million seniors and people with disabilities have no dental insurance and no idea as to how they will be able to pay for the very expensive dental procedures that they may need. And this is really quite incredible. As a result of that, in the richest country in the world, nearly 1 out of 5 seniors have lost all of their natural teeth, and far more have untreated gum disease, which can increase the risk of cardiovascular disease, diabetes, and rheumatoid arthritis. And it's not just seniors that we're talking about. Here in Vermont, 48% of children have tooth decay before entering 3rd grade, often because their parents cannot afford or cannot find a dentist. Meanwhile, there are fewer than 400 practicing dentists in Vermont, a full 15% of whom are 65 or over. And that is why it has been one of my top priorities to improve access to dental care around Vermont, starting right here. And I am very proud to have worked along with Senator Welch to secure $4.6 million in funding for the University of Detroit Mercy and the Vermont Medical Society to open this new state-of-the-art clinic and training site. In September of 2027, the first class of students will arrive from Detroit and will begin treating thousands of Vermonters. And very importantly, Vermonters will get their coverage through Medicaid. They will be welcome to the clinic. So with that, I'd like to thank Detroit Mercy and the Vermont Medical Society, and I'll turn the mic over to Senator Welch. Peter?
Thank you, Bernie. You know, I come from a family of dentists. My father was a dentist. Two of my uncles were dentists. Both my grandfathers were dentists. And that's when we had a lot of dentists. And we need dentists. And what is so wonderful, Bernie, about what you're doing with this project is we're taking Vermont control so that we can produce dentists that can serve Vermonters. That's like job one. I also want to reiterate what Senator Sanders said about the incredible need for dental care. It is such a crisis, especially for young moms and dads, when their kids, they know they need dental care and they can't get it. It is just out of reach. It's not affordable. It doesn't have to be that way. Most countries with the wealth of the United States, or a lot less, have dental care that's available to people, and it's an absolute scandal that that's not the case. And Bernie, I just want to acknowledge, this is important for Vermonters to know, since the day Bernie went to Congress, in the House and in the Senate, he has been the national champion for extending dental care along with other care, dental and vision, hearing. And Bernie, you have been our champion in the United States Senate on pushing that. I was glad to be a part of this, but let's make it clear, Bernie was the person who really made this happen. And I want to express to you my gratitude, Senator Sanders, and the gratitude of all Vermonters for this extraordinary accomplishment of having this partnership with Detroit Mercy, where we in Vermont are going to be producing dentists that are going to take care of our Vermont families. Thank you.
Dr. Axel?
And I want to reiterate, the vision for this project really came about because of the shortage of dentists and the oral health access needs of the state of Vermont. But truly, it's a partnership with Senator Sanders and Senator Welch providing the support to help bring us here, but we also have the support of Northeast Delta, the support of the Vermont State Dental Society. Even our relationship with Akabe, the building owner here, is one that's a true partnership. And it's a true partnership that helps us achieve this project in a way that really no other project could be achieved. We're here for the long run. As people have said to me, you know, if you want to go fast, go alone. If you want to go far, you go together. And we're here to be together because this project is here to stay. It's going to be transformative for the people of Vermont. And not only is it going to provide access to oral health care, the improved oral health care will ultimately provide overall general health wellness improvements in those patients who suffer from these diseases. Whether you can't get nutrition or you have the chronic inflammation of periodontal disease, those conditions can impact your overall health and wellness, impact your employability, cause absenteeism from work, absenteeism from school. So these solutions have far and broad-reaching impacts. And so we want to thank you all for being here to celebrate this moment. And we invite you back when our students first arrive to be here to greet them and welcome them as well. So thank you so much.
Thank you. Okay, again, I want to recognize Patrick Gallivant for the Vermont Dental Society and the entire society for the great work they've done in working with Detroit Mercy to make this program possible. Any questions? Yeah.
Thinking about the students that are coming over from Detroit after their first 2 years to finish their training here, are there any specific programs or initiatives to encourage those students coming to Vermont to stay and practice?
The short answer is absolutely. Yeah, I mean, the goal is that we believe that once these students come to Vermont, get around the state of Vermont, enjoy Vermont, that many of them will stay. So that is certainly one of the goals. We have a shortage of dentists, and we hope this will help. Will help us address that issue. Dr. Aksu, do you want to add anything?
I would say, you know, even beyond that, we've knit together a partnership here with the Vermont State Dental Society and with UVM's medical GPR residency. So this is more than just a dental school. It's really going to be an oral health center for us. And with the residency program here and with Patrick's presence here on this campus, we feel that that interknitting of all those partners is really going to make us a very special place, and the student experience will be more than just an educational one. It'll be a cultural one for them to begin to fall in love with the state of Vermont.
Other questions? Yes, ma'am.
What is the construction
So we're on track to probably turn the property over with most of the major work completed by the end of May of this year. We're in the process, we just placed an order for $1 million worth of equipment to be installed. And then we have probably another $1 million of equipment shortly thereafter just to get this up and going. And then we'll be purchasing, you know, all the little things that the dentists use, the handpieces, the instruments. And so it's really probably a 6-month period to get this up and running. We foresee that we may have dental patients being seen here as early as January of '27, so that the patients can then be screened, treatment planned, and then their needs identified, and any acute needs that may be needed, the dentist will treat, of course. And then the students' arrival in May, they'll have a running start to get going and begin treating patients efficiently and delivering care to make an impact.
Are there any plans to expand the service to Vermonters in the southern part of the state?
So we've been working with Bi-State Health Society, which is the group that deals with federally qualified health centers and community health centers. And we are working on partnerships where students will rotate to the various community clinic sites.
Right. We have FQHCs all over the state of Vermont, and the hope is that we can work out a relationship where some of the students here will be able to get it all over Vermont. Yeah.
And then how did the partnership with specifically the University of Detroit come about? Why not a local program?
So for us, it's been really a mission-driven program. As a Jesuit and Mercy school, our mission is to provide access to education and service to underserved communities. And so as we were identifying places in the country that would enrich our students' experience, we identified Vermont as an area that could benefit from the assets of the program that we have and benefit from our students being trained here. And so it's really, it really goes to the core of the fundamental of the mission of the university. We have outreach programs all over the state of Michigan, and so one of the things is why do we limit ourselves to the state of Michigan? Let's do more. Let's make a national impact. And so we reached out to Patrick and the leadership of the Vermont State Dental Society. We got engaged with Senator Sanders and Senator Welch's office, and again, we built a partnership before we even decided to pull the gun and come on right out here. You know, we wanted to make sure our key to success is really building a coalition of local supporters with Delta Dental, Vermont State Dental Society, both Senator Sanders and Welch, the local community. I mean, it was really, that was the thing. We found that the response of the community was so positive, we could not come here.
Okay, and
Senator Sanders, are you concerned about Vermonters not being able to access some of these, given that it's Medicaid funding and the limitations in the Big Beautiful Bill?
look, the big, beautiful, so-called big, beautiful bill, in my view, was the worst piece of legislation written in the modern history of this country. It gave $1 trillion in tax breaks to the top 1%, and it paid for that by throwing 15 million Americans, low-income, working-class Americans, off of Medicaid and the Affordable Care Act. It is a disaster, and I can tell you, and I know I speak for Peter, when we get back, we're going to do everything we can to see that that's rescinded. The idea that we are the only major country on earth not to guarantee health care to all people is bad enough. To throw 15 million people off of the health care they have is totally unacceptable. Okay, thank you all very much. Was it going to do a tour now?
Sure.
Is that plan? Okay, follow us and get a tour.
As we walk through the building, one of the things that you're going to see is that the building was really designed for the patient experience. We wanted our patients to have a great experience while they're here, so with the opportunity to have all the natural light and windows, the patients will be here and enjoy the opportunity to feel Vermont while they're getting their dental care. So the average student treats about 50 patients. They see 50 patients over the course of a year. So they manage everything from start to finish. So imagine you haven't had dental care for multiple years. It may take a series of 20 or 25 appointments to get you back into shape. Wow. That's amazing. And we initially do a triage. We take care of the acute needs, the obvious areas of infection. We try to stabilize the mouth, and then we restore. And so we do like phase 1 and phase 2 treatment.
Right. So a patient could very well have several visits in order to get.
Yeah, we
in
typically
shape.
see a patient 2 to 3 times a month for the first year, just to get them stabilized and restored, and then they come back for routine care after that.
It's amazing.
Well, Merritt, you could also tell that there's about $1 million worth of work already done under the floor that nobody sees.
Right.
All the pipes, all the vacuum,
So
everything.
it's a fairly complicated process to get a dental implant.
tear the floor up in order to?
Yeah, everywhere.
Everything was torn up. The whole thing was taken out.
Senator Sanders, last time you were here, you were jumping over those holes to get one side to the other, if I remember correctly.
Piles of rock.
Piles of rock, exactly.
Excavating.
You know, I tell a little bit of a story. Many, many years ago, I lived up in the Northeast Kingdom in a tiny town called Stannard, near Hardwick. And I would see kids back then, kids 10, 11 years old, whose teeth were rotting in their mouth, rotting in their mouth. So I think over the years we have made progress through community health centers, et cetera. But this, no question, this is a major, major step forward for dental care in Vermont. I'm just very proud of the cooperation that we've gotten from Detroit Mercy and the Dental Society.
I'm Christopher Motter, CEO of Acabay Incorporated. We were visited by Mercy Dental last year with, I guess, would be the first contact of when Mercy came down looking for an area where they could branch out and support Vermonters with their oral health care. And after taking a look at the space and deciding on the construction layout that they would go with, we were proud to win the contract and start developing the floor and a half that the school will be occupying. And we're looking forward to bringing dental care to all Vermonters. It's been a tough road for people to get the kind of dental care they need here, and we're happy to be a part of it.
Hi, I'm Patrick Gallivan, the Executive Director of the Vermont State Dental Society, and we've partnered with the University of Detroit Mercy to help build the largest dental clinic in Vermont, and we're very excited about it for 2 reasons. One, for access to care for Vermonters, and secondly, for workforce and dental care. And I'd like our president, Dr. Heidi Kunkel, to introduce herself also.
Hi, I'm Dr. Heidi Kunkel. I'm president of the Vermont State Dental Society, and we're very excited about this new project coming to Vermont.
Hello, my name is Rob Kleiner. I'm Director of External Operations at Northeast Delta Dental, and we couldn't be more honored to donate $2 million to support this initiative, to bring more dentists into education and getting them trained so that they can support and help the health of Vermonters here in the state. Thank you.